Namaste, friends. Today we'll be discussing on a topic that is medical education in the year 2035. We will see how the AI will get integrated in medical education and what are the changes that are expected in the year 2035. As we know that today's medical education, that is patients seen by the medical students, is very limited. Their exposure is limited in the context that they don't really treat the patient. They basically examine and hypothesize what treatment could be given. This is a kind of a limitation for the medical students. But in the year 2035, there will be a lot of changes. There will be a case where the patients will become virtual and the patients can be treated, that is, these virtual patients can be treated by the medical students without really causing any harm to the real person. Old system, that is what is existent today. Today, the students seek medical education through books, textbooks, and videos, or could be, and even by the lectures and the clinical posting that they get limited exposure. This is going to change very soon with the integration of AI. Adaptive learning. So what is adaptive learning? With the introduction of AI, the students can have their own pace of learning. So for example, a student who is weak in ECG, the AI will make him to learn more ECG. A student who is weak in orthopedics will get a lot of more orthopedic cases. So this sort of an adaptive learning, the AI will understand where the actual student is weak and it will make him to learn that more, such a way that they get a very balanced and very adaptive learning at their own pace. So this is one of the major impact that AI can make in medical education. This is already being experimented in some of the Stanford University colleges where the adaptive learning is being experimented. This is going to be across all the medical colleges in almost all the throughout the planet by the year 2035, and India is not an exception. AR anatomy labs, that is augmented reality anatomy labs. This is almost an reality already today. In some of the medical colleges, even in India, already have got this kind of labs, that is augmented reality labs, basically for treating anatomy. So anatomy is basically learning the anatomy just by books or even by videos could be a bit difficult because the organs have got are three-dimensional structures. So just trying to learn them, their actual anatomy by these traditional way has got some limitations. The imagination cannot be very perfect. So with help of augmented reality, the students will actually experience the organs in real time. They'll be able to get inside the body and see how actually the organs are functioning almost in live. It is as though a live patient, how the heart is beating itself, how the blood is moving across. Such things can be generated with the help of AI. The understanding of the anatomy will be more perfect and more accurate with this help of augmented reality. That is going to happen almost everywhere in almost all medical colleges across the planet. AI mentors for doctors or postgraduate students. AI as a mentor will be in a real-time feedback giving to the doctors and also the postgraduates when they are actually seeing the virtual patient. And when it gives such a feedback, for example, what was right in his action when they saw the patient, when they were trying to simulate treating the patient, what went right, what went wrong, what are the things that he missed, for example, something he missed in the ECG, and was the CPR was adequate, was there any shortcomings when he was doing CPR, what emergency drug could have been given was not given, or what unnecessarily in a drug was given which could have caused problem to the patient. Such things can be given a live feedback to the student and also doctors, such this will give a build up more confidence in treating the patient. Also it will become more perfect. It will give a more kind of perfection to the even for the beginners to achieve the experience faster than the traditional way. And now let us come to the human touch. Now with this AI getting into the medical education, will this make the actual human teacher obsolete? This could be some kind of a thought that can come to many people, but I don't think so. The human factor or the human touch, that will be actually required even with advancements. In fact, this AI can improve the teachers also. They can also learn more and teach the students better along with this whatever AR, what augmented reality, virtual patients, AI getting into medical education. These will get more intermingled with the human doctors or human teachers to teach the students even better. And human touch is going to be there even in the year 2035. India's opportunity in this, we have got many medical colleges spread across the country. Some have got a very advanced or a very highly skilled staff or the highly skilled equipment for learning. Some colleges who are actually placed in a small towns, they have got some limitations. With this help of AI, this gap can be reduced. Even the students who are learning in a small colleges or small hospitals, for example, DNB and all that, they can learn now with help of AI as though they are learned in a high-tech or a very advanced hospital. Now, so having seen that year 2035, there are really a lot of changes, and the future of medical education with help of AI is very bright. This is my opinion, not only mine. It looks very bright because the quality of the education that we can give to our students will definitely be much better than what we are able to give today. The almost all the students will get equal opportunities, so they will get nice training. At the end of their course, they will become better doctors who can take actual decisions. Now we are, most of the students today, when they complete their undergraduates, they are not very confident in giving treatment. With the introduction of AI, this, what sort of a gap we are seeing, or what we are seeing as a missing in medical education, will get improved or will get reduced, and students' quality is going to improve. That's for today. Thank you.